Good morning. Thank you all for your continued support. Physical distancing and isolation may be great weapons in the fight against COVID, but they are far from ideal concepts for those with significant mental health problems. I'm so proud of how my colleagues, staff and volunteers at Jami have responded to the unprecedented challenges of the pandemic. And I just wanted to talk to you a little bit about some of the things that have been going on since we had to drastically change our services in response to the crisis. So those that would have been involved, for instance, in planning our annual fundraising events came together with our cafe staff to start producing meals for those most vulnerable and at risk. And almost overnight, we pulled all the cafe operations, all the food production, into our centre in Edgware, where we could adhere to social, I don't even like using the word social distancing, physical distancing. And if I could just introduce you to Bob and Mohammed, who are, there we go.
Hello.
Hi. Very busy making meals and distributing all sorts of things to some of our most isolated service users. We distribute tablet computers with SIM cards to make sure that people who otherwise would have no means of staying in contact are able to do so. And along with that, we're obviously doing all sorts of online groups. We're in contact with almost 400 people on a regular basis for individual support, and that doesn't include the many more that are using our online groups. Lockdown impacts the whole of society, and social media is full of people talking about the challenges of homeschooling and whether or not people should be going to parks and exercising, and whether or not and all sorts of challenges of spending an increased amount of time with immediate family. But I have to say, as I was climbing, I think it was 4 flights of stairs in East London to deliver a meal and a doorstep chat to a wonderful woman called Rosemary, I was just struck at the vastly different experience of so many of the people using our services. Actually, while I'm walking down here, can I just introduce you to one of our social workers, Anne?
Good morning. Who's
doing, continuing with as with all my colleagues, doing amazing stuff, supporting people. I was going to say virtually, but they're not virtually supporting people. They are genuine support that they are giving to people. I will just avoid Ben on the staircase. Ben is one of our wonderful peer support workers coming in to again continue to offer that support, which I will stop calling virtual support. It is absolutely real support. It's just in a slightly different means of delivery. What can I say? You are absolutely incredible in continuing to offer the vital support that you do to our organisation and to the community. The costs to us, the impact of COVID on our services is absolutely immense at the moment, and the financial costs of the additional services that we're providing in response to COVID are incredibly significant. But so is the human cost if we fail to deliver that support. Thank you so much for your support. Stay well, be well, and stay safe.